prepared.
What is the title of the project?
Is
A simple word will be enough. It's not there need to be a whole sentence, nothing like that. We are concerned on the only the understanding part, not the grammatic part.
Okay. Beta vulgaris as an alternative to eosin in histopathological staining procedure.
So you want to compare with the two staining procedures?
Yes, sir. Yes, sir. Just a replacement of the eosin with the beetroot juice. So, I need to compare the eosin, normal eosin staining and the beetroot staining.
Very good. So your hypothesis is that there is no significant difference between these two staining, right? So
Yeah.
you will have some kind of parameters. How will you judge whether the both are equal or there is a significant difference?
Sir, by observation mainly, and I will have some criteria like clarity of staining, uniformity.
So
Then
yeah,
the
so
cytoplasmic staining of both will compare that.
You can think of a microscopic camera, you can think of image processing, you can think of such idea so that your objective error can be eliminated, or you may have to use the two observers, something like that. But then suppose if I tell you that your hypothesis is that there is no significant difference between two, right? Now in this case, if you take only sample of 10, 10 with this, 10 with that. So when you apply the statistical test, naturally you are not going to get any significant difference because of small sample size.
Oh, yes, sir.
But then what will happen in this case? Your alpha error is okay, but then beta error will be too much. Your power of study will not be that much. And that's why in such a study where you want to show that there is no significant difference, still then you need to give a more sample size. Otherwise, you will not be able to postulate, right? Because what happens that medical representative come to the clinic and then say that doctors, look, this drug is much powerful and this is a no significant difference between your old drugs and new drugs, and it's less costly like that. But then if you look in that study that what is the beta error, then mostly they don't answer you what is the beta error. And even if they answer, they say, I will talk later on, something like that. So it is important to know about a beta error also in such studies. Otherwise, they can misguide you. And if you want to show that there is a statistical significant difference, in that study, probably if you don't mention about the beta error, there won't be much problem usually, right? So when you select the sample size, what should be the size at that time, computer will ask you for the power of the study, and at that time you can keep 80%, 85% like that. So we'll go for another roll number 10. Do you have anything ready?
Yes, sir.
Yeah, tell me that. What is the title of the
sir, we are planning one study with title Vitamin A status of women during and after pregnancy. A descriptive longitudinal study. So with the help of MTech emitter, we are going to check their vitamin A level.
So before giving but then the same samples you will be.
No, it would be just descriptive. Yes, sir. Yes.
Yeah,
same
but the same
woman,
subject you are going to give before and after.
Same.
So what will you compare?
Yes.
See, people will tell you that because you give a vitamin A, there can be increase in level. What the new thing you have searched? People can argue like that. Then what will be your answer? So what is your hypothesis? You understand my point? So you can have something like this, that you want to standardize the instrument, whether the instrument is correctly diagnosing or not. In that case, you can have a regression equation, or you can say that you can find out correlation coefficient between the two based on the vitamin A level in the blood and based on the instrument. And then you can find out what is the correlation coefficient, and you can have a regression equation based on the instrument measurement. You can find out the level in the blood. In that case, you use the formula y is equal to ax plus b. So you will be able to find out the constant b and also the a. And then this regression equation will tell you that even without blood level, you can calculate. That is the one, that could be one of your objective. Second thing is, if already the vitamin A level is good, then probably giving a vitamin A may not be giving that much high rise compared to those who are having the less vitamin A. So vitamin A deficiency people should show much rise. In this case, you will have two groups to compare, right? So one is having a low vitamin A level, another is in high vitamin A level. Or you can also group them in 3 parts also: low, high, and borderline. But in this case, you need to plot the normal distribution curve, and wherever there is a sharp curve, at that could be your borderline or dividing line. So that also can be done and compare that where the effect will be more. Then roll number 16. What is
my
your
title? My title is the association between body mass index and cardiorespiratory function among medical students.
Wonderful, wonderful study. Now, this will be a cross-section study or cohort study or a case control. Which kind of study you will label it?
Cross-sectional.
Yeah, cross-section study. But then, cross-section study, when you want to do it, the same cross-section study we can convert into a cohort study and case control study also. For example, your cross-sectional study is there, and you within that sample you can find out the cases. BMI is more, there is a cases, and BI normal, there is your control. And then you ask about their habits, for example, right?
Yes, smoking.
So at that time
food.
you can use it as a case control study, and they're the same people. You have a high BMI and a normal BMI, follow them up for something kind of, let's say, these chest pain, or for example, the performance in the exam, etc. So I would prefer that when you are doing a study and learning, you may have only 2 or 3 or 4 variables at the most. But if you want to move advance a little bit, you try to take 10 or 15 or 20 variables. Then you can find out what is the effect of each variable on one another. And in that case, you should go for multivariate analysis. So wonderful. So roll number 35.
Hello, sir. Good evening.
Yeah, good evening.
Sir, can I share the screen?
Yeah, you please. You have a right to share the screen?
No, sir.
Write out? No?
No.
Uh,
So, okay, I'll read it out, whatever I have prepared.
but if, let us see if Riddhiben is on the phone, then I can ask her. Just a minute.
Yes, sir.
And now you can share. She has already replied. You can share now. Try it out.
Yes. So, are you able to see it, sir?
Yeah, we can see.
Okay. So, good evening. So,
Just speak a bit loudly for me at least.
yes, sir. So, title of the study is basically the estimation of serum leptin levels in type 2 diabetes mellitus patient and its association with the cardiovascular disease. It's a case control study. And objective of the study is to determine the serum leptin levels in newly diagnosed patient of type 2 diabetes mellitus and healthy individuals. Also, we will determine the serum TG, triglyceride and LDL cholesterol level in the same, both the group, case and the control. And the estimate HbA1c will be the criteria. HbA1c level will also be estimated to diagnose the type 2 diabetes. It is an analytical case control study.
That's all, right?
No, sir. There is.
Yeah, okay. Go ahead.
So, coming to the material method, it will be a 6-month study which will be conducted from 1st October 2023 to 31st March 2024, and the site will be MGM Hospital Vashi. And subjects from for the study will be included from the diabetic OPD, which I think twice a week or in MGM. We conduct it twice a week. In MGM Hospital Vashi. Case group will be, now sir, here I have a doubt. So I considered it as a pilot study instead of taking the exact sample size. So 50 will be the case group which are newly diagnosed with type 2 diabetes, and control group is age gender match 50 healthy individuals, preferably the individuals who are attending blood bank for the blood donation. Verbal written informed consent will be taken from the patient as well as the healthy individual. Now coming to the sampling frame, it will be a sampling method. It will be the convenience. Like whenever I am there, the patient are coming. If it is they are fitting in my inclusion criteria, I will take the samples. Inclusion criteria will be the individual between the age group of 35 to 50 years will be included in the study for the both the groups, and newly diagnosed cases with the HbA1c above 6.5. So we will exclude if the HbA1c level is 6.5, on only above 6.5% will be considering the study. Coming to the exclusion criteria, the patient less than 18 years, also suspected pregnancy cases will be excluded. In diabetic group, the patient on any therapy or treatment are also will be excluded. Also, the patient with previous history or any treatment of cardiovascular complications or disorder, or the patient on statin will be excluded from the study. And here, to avoid a confounders, the patients of PCOS, metabolic syndrome, obese patients, because leptin tends to get increase in such patient. So we'll avoid that, we'll exclude these patients as well. Again, there are some conditions where HbA1c level get affected, like thalassemia, anemia. They will also be excluded from the study. So should I continue for the sample collection and methodology?
No, that is okay. But I ask you one question. What is your hypothesis? What will be your answer?
Sir, my hypothesis will be that serum level is definitely on a higher side in type 2 diabetes mellitus patients, and it may lead to the cardiovascular disorder. So these patients have a more tendency because it might affect the LDL metabolism that lead to the cardiovascular complication.
But
that
then,
is my hypothesis.
You are also including the underlying mechanism also. Your hypothesis should be you either spell out the type 2 diabetes, there will be more leptin, or more leptin will lead to cardiovascular disorder, something like that. So to make it simple.
Okay, sir.
So you mean to say if leptin levels is more, it will lead to more cardiovascular disorder, right?
Yes, sir. Yes.
So you will be selecting the people suffering from cardiovascular disease or suffering from diabetes mellitus. What do you mean?
From diabetes mellitus, sir.
So in diabetes mellitus, so see, you are confusing two things in a single thing.
Okay.
In this case, in your case, what is your case is a diabetes mellitus.
Yes.
So your study means that in diabetic mellitus, leptin levels are higher. That is what you mean to say, right?
Yes.
So your diabetes is a case and control is a, so, and it's associated with the cardiovascular disorder that you can avoid as a title.
Okay.
Because otherwise what will happen, you need to find out the cases of cardiovascular disorder and no cardiovascular disease. In cardiovascular disorders, also diabetic, non-diabetic. In no cardiovascular disease, also diabetic, non-diabetic. And then you will have 4 groups if you want to continue with this kind of thing. right?
Okay. So
So,
I should just say it serum leptin levels in type 2 diabetes mellitus and a normal patient.
yes,
So
simple. Your
it will be a
hypothesis is that
simple.
in type 2 diabetes mellitus, leptin levels will be significantly higher than
Okay.
those people which are having no diabetes mellitus.
Okay.
Otherwise, the study is good and you can carry on. But now this is a case control study, what you say. Now, what else can be done if I want to convert this in the cohort study? How will you convert into cohort? Hypothetically, even you can you convert? Yes, it is possible. For example, what you can do that you take a newly diagnosed diabetes 2 level, diabetes 2, type 2 diabetes, and normal people in both the group. Let's say you are taking 100 and follow them up, and how much rise is there in leptin level, that can be cohort can be done. The
Okay.
rise will be faster in diabetic compared to the non-diabetic.
Non-diabetic.
So this way, it is possible to take a cohort. Other
Okay.
thing could be, even within diabetes, there could be two groups: leptin level not too high and high. And these two you can follow it up. And how many people develop cardiovascular disease? Yes, no. This is also this way you can think of the cohort study. Similarly, if you want to do the randomized control trial within this, for example, right? So in that case, you need to find out that no diabetic, but leptin level higher and leptin level lower, right? So in that case, if you want to do the randomized control trial, in that you need to have some kind of intervention. If you don't have any kind of intervention, what you can do that both the groups, leptin level higher and normal, and then over a period of time, some of them will develop diabetes, right?
Okay.
And because we are not going to do any kind of intervention, it will be a very difficult to divide into two groups randomly, right?
Yes.
So experimental, there is something natural randomization in which you put some people on a diet. If they develop diabetes, put on one side, not develop diabetes, put on other side, and follow them up. But in this case, natural control will be there, but you won't have an intervention. In this case, if you want to do the control trial, what you can do that take a diabetic patients only and randomize the two groups. One group you advise them about diet, etc. Other group don't advise them, and then follow them up with a dietary advice, no dietary advice. What will happen to their leptin level? Now, in this case, one fallacy which you can caught with is you are keeping 6.5 as the borderline.
Yes.
Below that, no diabetes. More than that, diabetes. See, here the arbitrary figure you have taken 6.5. But what I suggest that you collect, let's say this is a pilot study, even if you can 10, this is enough for the pilot, no problem. But then when you can take, let's say 300, 200, 400, something like that, you will get a definitely curve where the curve will cut at the level of 6.3 or 6.8. That you will be able to find out. If you take that at a cutoff line, that will be better. And whenever it is possible for you, it is much better to compare you have two variables together, you try to compare correlation between these two, rather than making two groups and comparing leptin level.
Yes, sir.
Because the grouping at an international level, they avoid the grouping because the people manage the data as per their liking. That's the problem. So if you scientifically make a group based on the curve, that won't be a problem. So very good. So anyone else who is prepared or can share at least the at least you can share the your subject project proposal. There will be a lot of learning from this. Anyone else? Roll number 110 1635 over. Presence.
Sir,
Yeah.
so
Roll
this is
number, please.
Kumar
Roll
Saurabh,
number.
roll number 47.
47. Yes,
Kumar
please.
Saurabh. Sir, I am planning to conduct a study on prevalence of urinary tract infection among pregnant females and its effect on pregnancy outcomes, a cross-sectional case control study from a tertiary care center.
So what is your case and what is the control?
Sir, generally, if any pregnant female comes, so during the antenatal checkup, urinary urine culture is being done to see whether UTI is present or not.
Hmm.
So it will be done. We will take the history whether UTI is present either in first trimester, second trimester, or third trimester, and
Hmm.
it will be followed till the date of pregnancy outcome is there.
Hmm.
And then if UTI is present, what was the effect on the pregnancy outcome? Was the mother, did she face any difficulty? Was she admitted in ICU or the baby was admitted in the ICU? In this case, we will take the cases will be, all
So-
those cases where UTI will be
So
present.
what is the outcome? What is the outcome here?
Sir, if UTI is there, then there may be some grave consequences on the
So
baby.
UTI is the exposure, right?
Yes,
Exposed.
yes.
And the outcome is pregnancy outcome, right?
Pregnancy outcome.
So
We-
pregnancy outcome, if you want to label it as a case control study,
Yes, sir.
then your pregnancy outcome, that would be a case. Normal account, there is a control.
Yes,
And you retrospectively find out whether there's infection was there or not. But the
Yes,
way
sir.
you are describing, you have two groups, urinary tract infection, no infection. And then prospectively you are comparing what is the outcome. Then
So
you
if-
can label it as a cohort study.
UTI will be absent, then those will be the cases. Those will be the controls. And if
Yeah.
UTI is present, they
So-
will be cases.
So exposure variable you are taking in much before. So this is a cohort study. You have two cohort which you are following up, right?
Yes, sir. So
So
can't it label it as a case control study, sir? Because all those pregnant females where UTI will not be present will act as controls because they will be comparable
See-
with sex
see
and
the-
age wise.
I will tell you, if you are taking outcome first, I will give a simple example. Person having malaria, having no malaria,
Yes, sir.
and you are asking about where do they stay, whether they cover their body or not while sleeping. When the outcome is first in your study, and then you are asking for the exposure variable, that is a case control study. But here, exposure variable, that is a UTI, you are taking two groups, UTI present, UTI absent, and then follow them up prospect. You have a two cohorts in your hand, right? And follow them up for the outcome. So this is a cohort study. Understood?
Okay, sir. Okay, sir.
Because easily, that's why I told that they, so case you control, this is a, I would use this word, this is not proper words to use. It's the outcome present, outcome absent, and you are looking for what was the exposure. This is a clear-cut, simple language. But the
So-
people, you are using the word case control study, so we are using the word case control study. So
If
you
we
have to
do
have
the
outcome
retrospective-
first.
If we try to do it in a retrospective way, if we try to search the records and do such study, will it be termed as case control?
See, even if you go for retrospective, right? In that, what you should first have in mind that wrong the outcome and normal outcome of pregnancy. And then retrospectively find out whether the exposure variable there or not, then you can call it as a case control study.
Okay, okay, sir.
How you
Okay,
are starting the study, that depends, right?
okay, sir.
Same study.
Okay, thank you, sir.
Just a minute. So, wonderful. Now, in this case, what are the confounding variable? Can you tell me that? Because you need to consider that.
Yeah, if the patient is having symptoms or if the lab report was wrong or if antibiotics was taken before the collection of sample, in that case, even if UTI is present, there will no be any organism growth in the urine culture. So antibiotic has been taken before
Then-
the collection.
Then number of delivery. When you match no case with control, a particular outcome, at that time the same, because if you look at the fourth or fifth delivery and compare in a control, you have a first delivery. So while taking the case and control, Just pay attention. Okay, next person who is taken? Anyone? Roll number 1, 10, 16, 35, 47 over. Anyone else? Because if you are not ready with the lesson assignment, even instantly also you can come out. I can I can give you 100 of the examples at a stretch. You just think of eye, ear, nose, hair, and start. Everywhere you have two, three things. Hands, abdomen. You talk of any system, for example, liver, jaundice, fever. So many things you will have, right? So anyone else? Salil Sharma, have you spoken about anything? Salil Sharma, are you listening? Harsh Auditya, Randhir Kumar is expert, so he is already. Bhavna Dakate. So let me spell out like this. The roll number 11 to 15. Anyone present over here? 11 to 15? All absent. Roll number 21 to 25? 26 to 30?
Yes, sir.
Yeah, please, Harsh, come out. What is your topic or project? You can think of. So where do you stay? Dr. Harsh, where do you stay? Dr. Harsh, where do you stay? You unmute yourself. Harsh.
Hello.
Okay. Hello.
Hello.
Are you listening?
The network issue. Hello.
Okay, someone else may take over. Dr. Neela. Dr. Tushar Kalra. Can you tell me your topic? I think people don't listen to me, or I am not able to hear you. Sumit Devare.
Hello, sir.
Yeah, can you tell me about your project? What is your roll number?
Sir, my roll number is 55, sir.
55.
Yes.
Okay. Tell me something about your project.
Yes, sir. Sir, I'm planning to do on non-communicable disease and focusing on the risk factor.
Good. So now which kind of study you will carry out?
Sir, I think I'll carry out cohort study, sir.
Okay, in that cohort study, let us presume that you are talking about, let's say, hypertension you want to take, or
Yes, sir. Hypertension, sir.
Okay, hypertension, that you want to take a cohort study, right?
Yes,
so risk factor, you will have two groups, with risk factor, without risk factor. Okay.
Yes, sir.
And how much population, where do you stay?
Sir, I stay in Bharuch, sir.
Bharuch. So let's say hypothetically you want to talk about the whole Bharuch town, right? How much population Bharuch town is having?
Sir, I'm not sure, sir.
Maybe let's say around 5 lakh.
Yes, sir. Around
Let's
6
say
to
5
7
lakh.
lakhs, sir. Yes. Yes,
now, so suppose 7 lakh. Out of 7 lakh, how much population you will have to take? Your cohort study, you want to talk about the Bharuch town, and these are 7 lakh population. You need to take around 700 people, 400 people, or 800, 8,000. How much? Have you calculated with AP info?
No, sir. I haven't calculated, sir.
So you should be able to calculate. Either you can go for the cohort study or case control study, or let's go for cohort study and calculate, put a approximate level that the people having a risk factor, people not having risk factor, how much will be the outcome? In risk factor, let's say there will be 10% people having hypertension, no risk factor 3%, like this, and then you can compare. Suppose hypothetically we can say that 7,000 is your two groups, 7,000 having risk factor and 7,000 not having the risk factor. So suppose if you want to do this, then what will be your risk? What are the risk factors which you're going to include? Just one or two?
Sir, mainly, sir, addiction, smoking.
Yes.
And sir, diet. So,
Yeah, so that everything you need to specify, this smoking. Then if there's a permutation and combination, you should spell out that even if there is a one risk factor, are you going to take? If there's two risk factors of the three risk factors, so you will have, because you can have more cohorts also, or in the same cohort you can have two things. One cohort with any risk factor, cohort with no risk factor. And then at the time of further analysis also, you can have one risk factor, two risk factor, three factors like that. But if you want to do that, then you should be very clear that the people with a risk factor, you need to take maybe a 14,000, 21,000, because you have a multiple strata later on for the analysis. And no risk factor, maybe only 7,000 or 5,000. So this is important when you are doing
Yes,
a
sir.
cohort study.
yes, sir.
Then your outcome will be there. Here, what you will have? You will have a odds ratio, or you will have attributable risk. What you will have?
Sir, odds ratio, sir.
Because in case control study, you take odds ratio, but in cohort study, although you can take odds ratio, but better would be attributable risk and relative risk, because you have a denominator in your hand. That's why
Yes, sir.
you can go for the risk calculation, right? So here
Yes, sir.
we have the attributable risk. And sometimes people say that if I ask you a question whether tea is more harmful, or let's say the let me talk about the something like the drugs people take, no? Drugs is more harmful or tea is more harmful to the population? What will be your answer?
Things that drugs are
So when you talk about the population attributable risk, because ultimately you are going to calculate population attributable risk for the Bharuch, which factor, if you remove it, will have more effect on the population. So the people in Bharuch, out of 7 lakh people, let's say, almost 6,60,000 people are consuming tea, while the drugs are consumed by only 100 people, right?
yes,
So for the population, when you calculate the population attributable risk, if you remove that particular component, how much will be the improvement in the population? That is population attributable risk. So in that case, T will be more.
harmful.
So as a public health specialist in community medicine, people should know how to calculate all this so that you can suggest the policy changes that which one
Yes,
is
sir.
better. Wonderful.
Yes, sir.
Smith. Anyone
Yes.
else who would like to?
Thank you,
present?
sir.
Yeah. Anyone else? So, if no one is there, we'll be going further.
Hello, sir.
Yeah, please.
So I'm roll number 1, Dr. Akshada Shinde. Roll number 2, sorry.
Roll number 2, yes.
Sir, we usually for dog bite or cat bite, any kind of animal bite, we go for rabies vaccination. So especially for category 2 and 3 bites. So in that case, when intradermal schedule is followed, the first 3 doses, they are covered in 1 week. So patient compliance is good. But
Yes.
for the 4th dose, usually people do not turn up. So we can plan a study to find out the factors responsible for people missing out on the last dose of their vaccination. So we can maybe plan a cross-sectional kind of study wherein we can have a consecutive purposive sampling of people coming to OPD or showing up at GOPD or casualty, whichever suits are set up. And then we can take healthcare providers side reason and their patient self-reported reasons also, and maybe try to find out the different factors.
This is a wonderful presentation by you, which gives a lot of insight for the learning. For example, when you want to find out that why people don't turn up, and you are sitting in the OPD, the people who don't turn up doesn't turn up to the OPD. So naturally, you should have a database with you, and then you can telephonically follow up. You should have a clear telephone with you. Then it will be possible. Other thing is that such a study are better to be carried out in the field if possible, because or you should have a multi-centric study, because your sample, say for 400, 300, 400 like that. In this case, another person also talked about that whatever I get, I will take. So this is a ridiculous in the research. It is not possible. Your purposive sample is to be done as a last resort. For example, someone told that in diabetic patients who will come in this, I will do. Instead of that, you can do like this, that out of the consecutive 100 patients of diabetes, every 10th or every 5th, I will take like that. You can involve other colleagues. In this case, your dog bite cases, either you take all the cases or take every 5th, but you go for randomization. Because there is nothing like when you are there and you are taking. You try to have your colleagues take their support. Or just meticulously record contact number each and every one coming for the dog bite or cat bite. And those who come back, ask them the question, yeah, well, how could you remember how you were told about it or not? All those kind of things. And who didn't turn them on, talk to them on the phone number, you have missed your thing, and what should be the reason? And any kind of study you do, you should have purpose in mind that you want to improve this situation. So after doing 2 months or 3 months thing, you find out what is the reason, whether the good explanation, who was the giving, who was explaining, etc., or which day people, which unit was there, and then try to imbibe the positive things. And after next another 3 months, you should go for explaining in details to all those people and find out whether there was improvement or not. Or the whole purpose of this multicentric, the 62 people are from various institutes. Let's say we are from 40 institutes. You design this study so that all the 40, at least 10 or 15 centers in my college, in your college, like that. And all we follow, one is a rapid cross-section study. For example, number of the patients coming to this and whether they are coming for which one was dose. So because hypothetically, whether it was the fourth dose or first dose or second or third dose, ideally, they should be equal in number. Unless there is a season, in season 1, 2, 3 will be more, fourth is less. So if we do multi-centric study, then we'll have a better idea on this. But yes, you call it as a cross-section study or retrospective study, case control cohort, which kind of study you will call it?
Sir, I had in mind cross-sectional kind of study.
Cross-sectional, see in that both the things, the reason, exposure and outcome, both you do assess together. But here you have opportunity. You have two things, outcome. What is the outcome? People not turning up, that is the outcome. And people turning up, this is a control. In both you try to ask what were the reasons. As in exposure thing, then you can label it as a case control study. But then you explain the people thoroughly and another group is not explaining thoroughly. And then you look out whether they are coming up or not coming up, that will become a cohort study. So wonderful. Anyone else would like to describe?
Thank you, sir.
Yeah.
So I'm roll number 32, Maya.
Yeah. Please.
I had project in mind where I would take a cohort of patients with psoriasis with the risk factor of smoking, and the outcome will be how many of them develop psoriatic arthritis. So what is the association of smoking with progression of psoriasis to psoriatic arthritis?
So you have a psoriatic case, let's say, find a psoriatic case, out of them, 300 are smoking, 200 are not smoking.
Yes.
Your base level is a psoriatic patients,
Yes.
and you have exposure level smoking, no smoking, and whether they develop arthritis or not.
Arthritis, psoriatic arthritis.
So, okay, that will be wonderful, your core study. Only thing, tell me how you are going to take a sample and what will be your population.
So, sir, my population, I'm from Navi Mumbai. So, all the patients of psoriasis that are coming to our dermatology OPD, and because the prevalence is only less, I will take all of them.
Okay. So, your population is patients of psoriasis coming to OPD of your hospital, right?
Yes.
So, I hope that all of you have taken 10 students for teaching. If you have not taken, you try to motivate 10 UG students or something like that, to whom you teach it, so that we have 62 people. That means around 600 students of this group. So out of 600, even if 10 or 20 or 30 participate for any particular study, it will be wonderful. Because in Navi Mumbai, because of the humidity factor, which affects all the patients, some of the observation you will not be able to come out with that. So if you take other cities like Ahmedabad or Rajasthan, something like that, and if you go for this, that will be good. So you will be finding out what out of this, population attributable risk or odds ratio?
Odds ratio.
Which parameter you will find out to compare?
Odds ratio.
No, this is when you say it is a cohort study, it will be relative risk or attributable risk, right?
Relative risk, yes.
Yeah. So if you remove the smoking, how do the effect?
Yes.
And in this case, you are taking a whole population, but can you take something, think of other things? Other arthritis, if you take psoriatic arthritis and other arthritis, and try to find out in that whether there is a smoking present or not.
Okay, so psoriatic arthritis versus rheumatoid arthritis and smoking.
Yeah, that can also be taken. So you see, you should think out of box. Take the one says smoking, that this one, and maybe you can take an age factor or the duration of the smoking or duration of the psoriatic arthritis. So many things, and the duration of study you should be taking. And my gut feeling is that your cohort study will not be successful in this, because to develop a psoriatic arthritis is a long duration thing, rather than you can go for retrospective study. That is a case control study that will give you much faster results. Anyway, good thing. Anyone else would like to present? Now, anyone who presents, we should be able to, now I'm going to last 20 minutes, whatever you present, we would be able to apply all the statistical tests so far what we have learned, and that will be possible. Let's see faster. Who else would like to present?
Hello, sir.
Yeah.
This is roll number 10. Sir, actually, the study what I was supposed to present, it is different from that you told me. Because we are planning two studies, sir. One which you told us, that is MTech meter standardization. So for that study, we are taking drivers in rural area as a population.
Yeah.
And we will be just checking their vitamin A blood levels and MTech meter finding. And afterwards, we will be giving intervention like vitamin A supplement. And after 1 month, we will be doing same thing, vitamin A blood level and MTech meter finding. So that is one study. So for that study, we are taking study design as evaluation of new diagnostic test.
But then the type of the study would be cohort study, right? You are comparing over a period of time. Intervention, no intervention. Intervention trial you have, and you will
Yes.
have, but basically cohort study it is. Right?
So cohort study only we have to write, or new diagnostic methods? Sir?
That also you can write out, but new diagnostic method. But there is the overall objective of the study, new diagnosis. But the type of a study is the cohort study, which you are carrying out.
Oh,
Yeah.
okay, sir. Or
So now,
this experimental study, sir.
That also you can say interventional or experimental. So in study design, usually we use the word interventional study in the cohort study with the intervention.
Okay.
We have intervention group, non-intervention group, right? And,
Okay. Or sir,
and
yeah.
diagnostic, you are finding out in that what you are doing, you are finding out how much the correlation is there between the two continuous variables, and the correlation
Yeah.
you will be able to find out that. And
And
for that,
sensitivity and specificity also.
yeah, that
We want.
is also possible in sensitivity and specificity screening test. You can use the word, right? And for that matter, the most important factor would be to decide about the borderline. So
Yes, sir.
and all the participants, please remember that whenever with a single test, when the test is based on the reading, particularly hemoglobin for the 11, 12, 13, 14, or let's say 1 to 8 like this, or vitamin A is 0 to 99.9 like this. So the same test, just by reading the method of reading, you can increase the sensitivity, you can increase the specificity, and you can decide the borderline. This is very, very important piece of fact. And you take a anemia chart, or you talk of the body mass index, anything which you take. So how you decide your cutoff line, that is the most important thing. And in the community, when you go with any test, try to do the overdiagnosis. Try to go for the most sensitive test when you want to find in the community. And when you find a lot of people, before starting a treatment, you make your borderline very stringent and go for high specificity, so that between the there will be a borderline between screening and then the starting a treatment, and those should be followed up. So deciding the borderline in such a way so that the same test, high sensitivity, same test, high specificity. So
so can we use ROC curves?
Yeah, that can be used, and in that the same level will be there, but in ROC curve you decide the border in such a way so that you have both the things together, and there will be few things who will be a borderline. Only follow them. You need not follow the whole lot, right?
Yes.
About
and sir, one more thing, sir. And the study, the pilot project for this EP-Info, we were telling about the vitamin A deficiency before pregnancy and after delivery. And for that purpose, we are just using MTech emitter. So that was not for standardization. It was just to know the vitamin A status of pregnant woman. It's before and after. It was just an observational study.
Yeah, observational and before and after comparison, what is the different level? And you can also call it as a prevalence study also, because you want to find out prevalence. What is the prevalence of the that is possible.
Yes,
so
sir.
Now you should be able to use whatever your data is there. You should have enough data in your hand so that you can find out you can use the multiple commands, right? So just maybe 5-7 minutes on how you will be using the different commands. I hope that all of you have by now used the EP-Info. Can you see the screen?
No, sir.
Sir, no.
Okay. Let's see the screen. No, I think you can see the screen.
Yes, sir.
We'll take a study, baby blood pressure. Now here, first we look at the table. These are the samples given in the AP info. Here is a birth weight is there, and there is a systolic blood pressure, age in days, birth weight. Here we want to find out, let's say like this, vitamin A level and then the blood level and the vitamin A according to the instrument, or you have correlation between birth weight and systolic blood, or birth weight and age in days, like this. So,
Sir, it is not visible. Are you showing any data or what?
yeah, data, you will be looking at, when I look at this analysis, probably you will be able to see that. I'm just looking at the frequency. And then, can you see the now?
No, sir, data is not visible.
Data is, even the screen, you do see the read or something like that?
No, sir, the whole, just your desktop is visible, which contains all the
Folder is visible, sir.
Folder.
Local disk C.
local disk.
1 minute. Say, then AP info 7. Is it seen now?
Yes, sir.
Yes.
AP
No?
info. AP info.
Read file you cannot see?
Yeah, read file is visible.
Yes.
Project. 1 minute. Let me close down the things and then choose so that you will be able to better. Cell window is closed. Again, I said, and then now, is it seen? This is seen or not?
Yes, yes, sir.
Yes, sir.
Okay. I wanted to just show you this command, the linear regression, right? Between two variables, birth weight, and there is a blood pressure, systolic blood pressure. Whether the birth weight and blood systolic are related with each other or not. So this is a F test they find out, and the F test is basically usually when you have the sample size, maybe more than 30, but you have 3 or 4 sample in your hand. At that time, your T test will not work, your Z test will not work. At that time, you need to use F test, right? By default, the AP info gives you F test. Now the correlation coefficient, you can see over here, is R is 0.19. So if this R is 0.19, if R is directly 1, that means a very good correlation coefficient. Is R is 0.1, much less correlation coefficient. And whether it is significant or not, coefficient 1.2. So p-value is 0.08. If it is less than 0.05, we'll call it as a significant. It seems that there is a correlation, but it fails to fulfill the criteria. So there is a likelihood, but we cannot say there is a strong correlation between the birth weight and the systolic blood pressure. So here the correlation, for that you go for linear regression. This is only I wanted to tell you. Other thing, you have age in days versus weight, birth weight. Here also you can say that there is a 0.01, almost zero. So there is no, in present study, there is no correlation between birth date, birth weight and the number of days, age of a child. This is how you apply the linear regression. And I hope all of you will be in your any study, you will be able to tables, means, command, you will be able to use it. So I just wanted to show you the linear regression command. And here your output is output 13.html. If you want to set your output somewhere, root out, that should be your command, and you can take the output wherever you want, whether you want to put in sample or whether you want to set somewhere in the output file, that you can decide over here, and you can say that that is how you want to route your file. So tomorrow or maybe a day after tomorrow, because next time we'll be going for non-parametric tests where we'll have a very small sample sizes. A clinician will be using that when you have only 8 cases or 5 cases, something like that. So all the non-parametric tests we are going to talk on the Monday. But before that, you have a Thursday, Friday, Saturday, Sunday, 4 days. You should design your study in such a way so that you also define your sample size and you find out which sampling technique you are going to use. As far as possible, hypothetically, at least you say that this is how you can take stratified, this is how you can take systematic random, this is how you can simple random sampling. For simple random sampling, I hope that out of 62, 8 or 10 people might not have seen a random number table. And random number table can be seen in any pattern to find out the things. So next time, before I start with the various non-parametric tests, I would like to see all the 4 tables: simple random table, Z table, T table, chi-square table, and how to utilize the p-values and area under the curve so that you can calculate how many population will be affected. Meanwhile, I request all the I have been a part of all the 12 groups by my another mobile, and I can see that hardly any group is active. If you are not active, you are the loser. And I really tell you, try to recruit 10% for you to teach. If you don't find, just write me that I can't find out 10 students whom we can teach, right? And we are starting now a virtual medical college. As a part of that, all of you will have access to this course where we in future also we may upgrade it or we may put some more information. And if some of you wants to become a teacher, you will have a right to put the information over there. As a student, all of you will have access to the epidemiological course. Anyone who are left out in presentation of their study protocol or the project title? Anyone? Dr. Kumar?
Sir, I already told, na, roll number 47.
Okay. So anyone else? Anyone else? Mehul Trivedi. Who is Dr. Mehul Trivedi? You have thought of any project?
Sir, I'm thinking about to assess knowledge and attitude of HPV infected, HPV related infections and cancers among medical students. Sir.
In medical student, you will be able to find out cancer at this age.
No, sir, about knowledge.
Knowledge of cancer, yeah, okay. Knowledge you can always test. There is no problem. Yeah, but in testing knowledge, which kind of sample you are going to take?
Sir, purposive sampling.
Purposive sample in research has no meaning. You try to define your population. Say is the 1,000 student could also be a population, and out of them take a systematic random sampling every 8th person, something like that. That will be systematic random sampling. So while doing a research, let's have some kind of research ethos. So no purposive, no convenient sampling, nothing like that, right? So try to do that. And all of you should prepare the Google form or AP Info, as I told you, or maybe AP Collect, and then send to rest of the other colleges. Let them participate. So on Monday, I would request at least each one of you 12 studies, one from each group, should be ready with the data already collected through our group. So you can pass it to 10 more or 20 people. So the moment you keep a very small formats, 8 variables, 5 variables, 7 variables, so that we can fill it up and then have a feel of multicentric study. So anything else? Can you tell me how many of you have used the non-parametric test? Anyone has used non-parametric test? Kruskal-Wallis or something like that? Mann-Whitney test. So your the colleagues, no, which are in the field of clinical trials, etc., or clinicians may find it useful. And I may not be able to talk about in detail about the Poisson distribution, but that also youngsters, those who are less than 30 years or 35 years, should work on Poisson distribution, because when there is a rarity of the people, the rarity of the disease, that you can start using. Or for example, nowadays maternal deaths are very few in numbers. When maternal death occurs, the probability when the women will die or not, the probability is much less now. In this case, a Poisson distribution will be there, and you can find out based on the few things what will be there in the population. So, any question before I end? So if you write in a group that some of you still are not well versed with the AP Info, then during daytime, we'll be conducting the class, maybe 2 to 3 p.m. or like that. And we like that all of you learn that. Because our the batch will start sometime in 25th October or so. And before that, we want to see that in next 10 days or so, or next 15 days, you are well versed with the AP Info, the study design, the non-parametric test, etc. And the project budget, I will give you the just budget heading, and you should also find out where to look for the budget. So initially I had given 10 or 11 groups a specific task for your group to do it. If you do it, including like a evaluation, look for the funds, look for the multi-study study, try to have a collaboration, distribute the states and district and countries, etc. If you do it, then we will gain a lot of momentum, etc. Okay, thank you.
Thank you, sir.
Thank you, sir. Thank you.